We first saw it in the spring when COVID cases started to go up. There was a huge rise in the number of people that ended up having to be admitted to hospital. And now those alarm bells are starting to ring again, and more needs to be done to prepare the facilities for what's to come.
We've already seen a significant increase in volumes coming in through the emergency department, as an example. So we're up about 90% in the cases that we see of people presenting with respiratory illness type symptoms.
It's an early sign of what's to come, the surge to follow the second wave of COVID cases, bound to hit hospitals already on the verge of reaching capacity.
Remember that you're always going to see an increase in cases in the community, and then that's slowly going to start seeping in through people presenting into your emergency department. Then you'll start to see increases in inpatient visits and ICU admissions.
The number of people with COVID in Ontario hospitals peaked at more than 1,000 in early May. The surge in recent cases now has those numbers rising again. More than 200 people are admitted in the province as of today, with 47 in intensive care.
They do all kinds of scenarios, and there's one scenario when it says it's going to get much worse that contemplates that we do nothing. So if we just let the status quo prevail, that's when the projection is that it gets much worse, by the end of the year. And people say, well, that's a long way away. Well, yes, it is. But do you want to get to the stage where you all of a sudden have the hospitals full?
Toronto's occupancy rate is already over 91% according to provincial data, and that has hospitals already operating at a critical level.
What many people may not realize is that hospitals today are basically full.
The Ontario Hospital Association is raising the alarm with the province and is already in talks with government to find new ways to increase capacity.
Making sure that hospitals are funded for things like field hospitals, if they need to rent space in hotels and motels, re-equip them to be appropriate for healthcare services. Perhaps they can work with their partners in long-term care or in retirement homes and lease available space there.
That organization, along with many in the medical profession, have been pushing for stricter measures and COVID restrictions in an effort to curb the increase in cases sooner rather than later.
The challenge is how quickly do you respond to it, knowing that you're already a little bit behind in the data that you're seeing.
The province has confirmed that it is in discussions to try and do more to deal with the capacity issues. Back in April, the government did announce that 2,500 acute and critical care beds would be added to the system.